Good day. On the sidelines of the Health Diplomacy Seminar, I'm pleased to interview Her Excellency, the Minister of Health of Somalia, Dr. Hawa Hassan Mohamed. Thank you so much, Your Excellency, for your time.
Thank you for having me.
In Somalia, you managed to eradicate polio. This is a great success story. How did you manage to do that with all the challenges you have? You have war, you have displaced, you have refugees, you have a limited health force, and you have difficulties in accessing the community. How did you manage to do that?
I would say it's a multi-sectoral approach. Everyone really contributed to it, from UN agencies, local NGOs, the community leaders, religious leaders, the government, state members. Everyone took part. Everyone did their bit to achieve this, and definitely it's a joint force. As you said rightfully, there is a security issues. Some of the places you cannot access to it. We used to have problems. Nowadays it's less than before, but that was the case then. So what we did was we put a checkpoint in front of, where people can, enter to the district, for example, and we waited when the family come out with the children, give the medication to the children, and then they went back there. Slowly, that completely reached everyone. And also sometimes I think the community, it's oral community, they share information orally. They say there is a checkpoint in that place that doing this. The family deliberately came out to access medication for their children and to protect children from the diseases. And they got it, they got it access through that. So I think it really thought through and discussed with everyone who took part, and it came up with the idea, which is a brilliant idea. And as a result of that, Somalia didn't have any case of polio since August 2014.
This is amazing.
Absolutely.
Really. And so in Somalia, you have different health authorities. Do you use health diplomacy concept to coordinate the work of everyone to reach the communities?
Of course we have. I think health sector in Somalia is so modular, I could say, because we all work together. We all there to provide services to the community and strengthen the system, health system that we have, and obviously capacitate and inject the capacity to different level of ministries and different level of health services. And if you can, just for example, if I give you the way we work together, there is a different layer of responsibility from local community, local administration, state members, and so on, and the government. If something happened, the first initial response is who is nearest to the responsibility, let's say community workers or maybe health workforce that placed in that area, and then the administration level that is, support that and respond to that. And also the state members have the responsibility to do something about it. Then the government need to support that and supplement anything that is done by the community that live in this area. And also sometimes happen that something happen in a federal government area, and the federal government alongside and in supporting, or maybe alongside other member states supported and something. So it's a kind of shared responsibility and doing what we can when it's needed and how it's needed.
Now we are attending the 5th seminar on health diplomacy. What are the results you would like to see? What are you expecting to get out of this seminar?
I still think there is a lack of awareness in the impact that in health alone, providing health services can provide to the country, to the community, to globally the whole nations, because we put emphasis in, especially where there is insecurity like Somalia, we put emphasis in providing, increasing the capacity of soldiers, making sure they have more resources for them to combat the militant if there is any, and so on and so on. I certainly believe if we provide services to the community, very good services to the community, and use health as diplomacy to negotiate with different partners, the country can be stabilized before anything else. They can do the same. I guess I want to say health is the key part of that. So it's not used that much, especially the government don't use much, and also the UN agency sometimes might be doing something similar to that level, but in terms of understanding the impact that will have, it's not there. So I think raising awareness is one of the key issues that we need to focus from now on.
Thank you so much.
Thank you.